I will talk today about the epidemiology of mortality for acute myocardial infarction in the United States. I am Giuseppe Lippi. I am Professor of Clinical Biochemistry at the University Hospital of Verona, where I'm also Dean of the Medical Faculty and Director of the local laboratory. The title of the article is Epidemiology of Mortality for Acute Myocardial Infarction in the United States 2024 update. It will appear on the April issue of the Mayo Clinic Proceedings. What we actually did is to perform a digital query of the US National Center for Health Statistics wide-ranging online data for Epidemiological Research database, which is a public health information system developed and maintained by the US Center for Disease Control and Prevention. This platform provides centralized access to population-based health data and supports epidemiological research, surveillance, and policy analysis. Mortality data were extracted with the EC10 code E21, which corresponds to the acute myocardial infarction for the year 2024, which is the most recent complete available database. For patients, this means that we will have an updated statistic about the demographic of acute myocardial infarction in the United States, and the place of death, and especially we can then provide a kind of personalized prevention, because as much as we know about the data about the mortality of this pathology, then we could tailor the prevention according to the population at the highest risk of this myocardial infarction. For clinician means applying, as I said before, a personalized prevention and a personalized therapy, because the wider knowledge of the pathology of myocardial infarction enables us to apply to target population prevention and drugs. The next line of research in this area is to understand better the physiopathology of myocardial infarction, especially on the most vulnerable populations, which are male in ancient age. I would say after the age of 50 and 60, we have seen a peak of incidence of acute myocardial infarction. And this is very, very important, because as the better we know the population, the better we know how to prevent the disease. So what we actually obtained from our analysis of the CDC database, it was that in 2024, we had more than 90,000 deaths attributed to myocardial infarction, 30,000 of which in women and nearly 55,000 in men. And we see that men have 57% higher overall mortality risk compared to women. And we also see that mortality rate increased markedly with advanced age, from 0.1 in the 15 to 24 years age group to over 347 per 1,000 in individuals aged 85 years and older. And we also saw that the 1 year increase in age was then associated with an 8.7% increase in mortality for myocardial infarction. More than half of myocardial infarction deaths occurred in hospital settings, although approximately 35% still occurred at home. I invite you to read the article Epidemiology of Mortality of Acute Myocardial Infarction in the United States 2024 update in the April issue of Mayo Clinic Proceedings.
We hope that you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access to information for our social media content, such as additional videos on our YouTube channel, www.youtube.com/Mayo Proceedings, or journal updates on Facebook, www.facebook.com/Mayo Clinic Proceedings. You can also follow us on X, formerly known as Twitter, available at Mayo Proceedings. More information about healthcare at Mayo Clinic, is available at www.mayoclinic.org. This content is copyrighted by Mayo Foundation for Medical Education and Research, published by Elsevier Incorporated. All rights are reserved, including those for text and data mining, AI training, and similar technologies.